We now begin an in-depth discussion with two experts on the global coronavirus pandemic. Several European countries have started to ease restrictions this week, with Germany, Austria, Denmark and the Czech Republic among those allowing certain businesses to reopen. Even Italy and Spain, two countries at the epicenter of the outbreak in Europe, have been loosening their lockdowns. But there have been concerns over whether this is the right decision at this point. We delve into this issue with Dr. Ben Cowling at the University of Hong Kong, who is heading the Division of Epidemiology and Biostatistics. We also have on the line Dr. Stanley Perlman, professor at the University of Iowa, who has been studying coronaviruses like COVID-19 for the last 38 years. Now, my first question to you, Dr. Cowling. Infections are still on the rise worldwide, but many governments are itching to restart their economies. We've seen some European countries partially ease their lockdowns and social distancing. Do you think this is wise at this point? I mean, considering how countries like Singapore, they saw an explosion of new cases this week and announced they would extend their lockdowns into June.
I think a lot of countries are going to choose to go very slowly now because it takes a week or 2 weeks to see the consequence of changes in public health measures, for example, relaxation in measures. I think they're going to go very slowly, but attempt to open up a little bit and see what happens. And if that's okay, then stay a little bit longer like that. And if it goes really well, then open up even more. But if the numbers of cases start to come up again, I think they'll tighten the restrictions again.
So they are going about it quite carefully. But do you think it's the right decision at this point, though?
Well, certainly the economies can't stay in the situation they're in forever. They need to loosen up at some point. And when the numbers have come down to a lower level, I think that's the right time to do it. But they need to be very careful about a resurgence in infections.
Well, Dr. Perlman, in the US as well, they've introduced a three-phase plan to slowly restart the economy. Do you think it's a good idea at this point?
Yeah, so this is a really good question because there's a lot of people in the U.S. who are really itching to reopen the economy without really thinking much about the possibility of a second wave of infections or a third wave of infections. So we have to pay a lot of attention to the kinds of numbers of cases that we see. Testing is still limited in the U.S., so we don't really know the full extent of the disease outbreak. So it's a balance between the economic implications and the health implications. I worry that we're going a little too fast because in some states that are thinking about opening up, we haven't even reached the peak yet. So I think that if we're going to do this, we have to do it very, very carefully.
But opening up, what would that involve, though? I mean, children going back to school, shops opening. To what extent should countries open up if they choose to do so? Dr. Perlman.
Yeah, so I think that they do. There's different parts are opened up. So I don't think schools are going to be opening any time in the near future. I don't think people are going to go to restaurants. Bars are, of course, a different question because young people tend to go to the bars. So I think that even opening up, we just have to be so careful about it because if people who don't make much money have to go back to factories that are not well protected against contagion, then this is a huge problem. This is what happened in my state in Iowa. Meat packers went back to stayed at work because it's a vital industry, but they were told that they needed to keep coming to work even when they had a fever. And there was been a huge outbreak in several meat packing plants in my state. So it's important that the right things be done. People are not going to go to restaurants and do some of the things you mentioned, not go to sporting events if they think they have a possibility of getting infected.
So really, I mean, we think about the short-term economic fallout, but we need to think long-term as well if people get sicker and sicker. Well, Dr. Cowling, some countries like Sweden, they're claiming that they've succeeded with, or succeeded to a certain extent with herd immunity. How does this work exactly, and why are some countries implementing or considering this model?
I think we're still a long way from herd immunity. The idea is if most of the people in your city or your country get infected, then you don't need to worry about COVID anymore. But now some studies have begun to appear in the scientific literature where they estimate how many people might have been infected using blood tests. And those studies are typically finding it's a small percentage, 2%, 3%, maybe 5%. In Sweden, I just saw one estimate, maybe 5%, up to 10%. So really a long way from herd immunity, and there's already been an enormous impact of COVID so far. So to go from 5% up to 50% would be 10 times more impact. So I don't think any country is going to choose that as their strategy because of the health consequences.
But what really is the appeal of this concept? Because some governments, they are talking about it and they are saying that they are doing well with it even.
Well, the appeal would be that you can go back to normal after your country or your city has reached herd immunity. But the problem is the journey there is so devastating on people's health that I don't think many countries would actually like to choose that as their strategy. Because it's too harmful.
And what about you, Dr. Perlman? What do you think about this herd community approach?
Well, I think I agree completely with what Dr. Cowling said. It's a great idea, but even in this disease, we don't really understand the immune response so well, so we can even make a guess of what's going on. We know for diseases like measles, once people are infected, they're really protected for life against the disease. We know you need to have 95 out of 100 people have an antibody or immune response to the virus for the herd immunity to be effective. It's probably lower in this disease than in measles, but we don't even really know how long immunity is going to last in this disease. We don't know which components of the immune system are really most important for protecting against reinfection and for protecting the community and minimizing transmission. So there's a lot to be learned here, and that makes the trying to figure out if herd immunity is going to be effective a little more difficult.
And so what you're saying is that we simply don't know enough about COVID-19 yet to see if herd immunity would work. And perhaps what's even more concerning is that we keep hearing about reinfections. So Dr. Perlman, what kind of complications and unknowns are we facing with COVID-19 at the moment in terms of being reinfected?
Yeah, so what we know from previous coronavirus infections that the immune response seems to be relatively short-lived compared to diseases like measles. So we find it hard to detect antibody responses after a year or two, especially in mild disease. It may even be much shorter than that. So we don't know if those people have low amounts of antibody can be reinfected. When we hear stories about people being reinfected, a lot of them it seems to be under the situation where they actually probably never were completely free of the virus rather than a reinfection. And the other thing that's maybe to me is the most important part is if you are reinfected, you now get very, very mild disease. And so if we converted a pneumonia into basically a cold-like disease, this would be better for the individual for sure. And if that person then transmitted much less than the person who had never seen the virus, then it's good for the society as well. So the goal here, maybe, we don't really know now, the goal may be to prevent severe disease and not really prevent reinfection. We will see because we don't really know.
And speaking of reinfections and this virus really coming back in the cycle, US officials at the FDA, at the CDC, even South Korean officials have been warning that resurgence of COVID-19 in wintertime might be even more deadly than what we're seeing now. So, Dr. Cowling, why is this so? Why are they saying that it could be even deadlier?
We know that there's a lot of additional I've lost my words. So there's a lot of additional health events happen in the winter. And so there's more flu, there's more common colds, there's more heart attacks, there's lots of other things. So if we have COVID in the winter, that means it will be adding to the stress on the healthcare system that's already there in the winter. Having said that, though, because of the social distancing measures and the community measures used against COVID, I think that flu would be less of a concern than it might normally be. And what we've seen in many countries in the past few months is that flu has gone away because of the social distancing, because of school closures, because of people staying at home a lot more, and because of people being much more aware about hygiene. There hasn't been much flu, and that may happen again this winter. But even so, I think countries now in the Southern Hemisphere are going to have a difficult fight against COVID for the coming months because it will be their winter. And for those of us in the Northern Hemisphere, we need to think ahead to what's going to happen next winter.
So finally, Dr. Perlman, just before we go, until a vaccine is really developed, it's developed and deemed safe, how then what do you think is the most effective way to handle this pandemic until then?
Yeah, so this is where we have the continuing to do the kinds of things that we're doing in terms of personal distancing, washing hands. If people go back to work and try to recreate normalcy in society, they still have to do all the measures, assuming that COVID-19 is around. So they have to do those kinds of things. If we get a vaccine, which people talk about over the next a few months to 18 months, then, and it works effectively, then maybe people will be more immune, and the idea of herd immunity will become important. A high percentage of people will be protected from disease and protected from transmitting to other people. So I think that's the best thing that we can do. If the virus comes back in a second wave, we're going to have to do the same kinds of things that we did this time to prevent it from becoming overwhelming. There's lots of susceptible patients out there still.
So really, at this point, we still don't know enough about the virus. We don't know how it's going to affect us if there is reinfections. We don't know if herd immunity is going to work. So we're going to be very careful at this point. All the costs could be immensely high, and well, it looks like the governments are going to have to be very careful in their approach. Well, I'm afraid that's all the time we have today. But thank you very much, Dr. Stanley Perlman and Dr. Ben Cowling from Iowa and Hong Kong.
Thank you.
Thank you.
This is also where we end the show today. Thank you for watching. We'll be back with more global insights at the same time tomorrow. Until then, have a lovely day or evening wherever you are. Goodbye.